The Montreal Cognitive Assessment was created in 1996 by Dr. Ziad Nasreddine in Montreal, Canada. It was validated in the setting of mild cognitive impairment, and has subsequently been adopted in numerous other settings clinically. The MoCA test is a one-page 30-point test administered in approximately 10 minutes. The test and administration instructions are freely accessible for clinicians at www.mocatis.org. The test is available in 35 languages or dialects. There are 3 alternate forms in English, designed for use in longitudinal settings. The MoCA assesses several cognitive domains. The short-term memory recall task involves 2 learning trials of 5 nuns and delayed recall after approximately 5 minutes. Visuospatial abilities are assessed using a clock drawing task and a 3-dimensional cube copy. Multiple aspects of executive functions are assessed using an alternation task adapted from the trail-making bee task, a phonemic fluency task, and a 2-item verbal abstraction task. Attention, concentration and working memory are evaluated using a sustained attention task, a serial subtraction task, and digits forward and backward. Language is assessed using a 3-item confrontation naming task with low familiarity animals, repetition of 2 syntactically complex sentences, and the aforementioned fluency task. Finally, orientation to time and place is evaluated. Validation study. The MoCA test validation study has shown the MoCA to be a promising tool for detecting mild cognitive impairment and early Alzheimer's disease compared with the well-known mini-mental state examination. However, it had been established that the MMSE is not well suited for mild cognitive impairment, which raises the question whether it is an adequate standard to compare performance with the MoCA. According to the validation study, the sensitivity and specificity of the MoCA for detecting MCI were 90% and 87% respectively, compared with 18% and 100% respectively for the MMSE. Subsequent work in other settings are less promising, though generally superior to the MMSE. In the same study, the sensitivity and specificity of the MoCA for detecting early AD were 100% and 87% respectively, compared with 78% and 100% respectively for the MMSE. Normal controls had an average age of 72.84 and average education of 13.33 years. Other applications. Since the MoCA assesses multiple cognitive domains, it may be a useful cognitive screening tool for several neurological diseases that affect younger populations, such as Parkinson's disease, vascular cognitive impairment, Huntington's disease, brain metastasis, primary brain tumors, and multiple sclerosis, and other conditions, such as traumatic brain injury, depression, schizophrenia and heart failure. Multiple cultural and linguistic variables may affect the norms of the MoCA across different countries and languages. Several cutoff scores have been suggested across different languages to compensate for education level of the population, and several modifications were also necessary to accommodate certain linguistic and cultural differences across different languages countries. However, most of these versions have not been validated. International versions, because MoCA is English-specific, linguistic and cultural translations are made in order to adapt the test in other countries. For instance, in the Filipino version that is still being developed, Filipino translation of the English words is supplemented with changes in some of the images that locals can identify, such as with the replacement of rhinoceros with an owl. The MoCA test has now been translated to 36 languages and dialects. Recommendation. The MoCA has been recommended by the National Institutes of Health and the Canadian Stroke Consortium for Detection of Vascular Cognitive Impairment, 2220-41. The Canadian Consensus Guidelines for Diagnosis and Treatment of Dementia for Detection of Mild Cognitive Impairment and Alzheimer, a Euro unregistered trademark S disease. References. Alzheimer's/MCI, Fujiwara YAL. Brief screening tool for mild cognitive impairment in older Japanese, validation of the Japanese version of the Montreal Cognitive Assessment. Geriat Gerontal. Int 2010. 10-225-232. Guoqi Hao al. Application study of quick cognitive screening test in identifying mild cognitive impairment. Neuroscience Bulletin, February 2010, 26, 1, 4754. Walter Whittish, Natalie Phillips, Ziad Nasreddine, Howard Schichko. Sensitivity and specificity of the Montreal Cognitive Assessment modified for individuals who are visually impaired. Journal of Visual Impairment and Blindness, June 2010, 104, 6, 360-368. Lewis CAAL. Cross-validation of the Montreal Cognitive Assessment in community-dwelling older adults residing in the southeastern U.S. International Journal of Geriatric Psychiatry, online issue, October 21, 2008, published 2009. 24, 197-201. Koski al. Measuring Cognition in a Geriatric Outpatient Clinic, Rush Analysis of the Montreal Cognitive Assessment. Journal of Geriatric Psychiatry and Neurology, Volume 22, No. 3, September 2009, page 151-160. Rahman, Tomaida Taha Abdel. El Ghafari, Maha Muhammad. Montreal Cognitive Assessment Arabic version, Reliability and Validity Prevalence of Mild Cognitive Impairment Among Elderly Attending Geriatric Clubs in Cairo. Geriatrics and Gerontology International, Volume 9, No. 1, March 2009, ppA 54/61. Junyoung Lee al. Brief Screening for Mild Cognitive Impairment in Elderly Outpatient Clinic, Validation of the Korean version of the Montreal Cognitive Assessment. J. Geriat Psychiatry Neural, June 2008, 21. 104-110. Dubinik al. Rapid Cognitive Improvement in Alzheimer, a Euro unregistered trademark S disease following paraspinal etanercept administration. Journal of Neuroinflammation, January 2008, 5-2. Wen HBA al. The Application of Montreal Cognitive Assessment in Urban Chinese Residents of Beijing. Zingwaneri K. Zazi 2008 Jan. 47, 1, 36-9. Chinese. Smith T. al. The Montreal Cognitive Assessment, Validity and Utility in a Memory Clinic Setting. Kanjay Psychiatry, 2007 May. 52, 5, 329-32. J. Reban. Montrealski Kognitivny Test, Prenoske Diagnostis Predemencji, Seska Geriatrica, Review 2006 224-229. Nasreddine Z.S., Phillips N.A., Bar Copyright Dirian v. Charbon U.S., Whitehead v. Colin I., Cummings J.L., Schichko H. The Montreal Cognitive Assessment, a brief screening tool for mild cognitive impairment. Journal of the American Geriatric Society 53 695-699, 2005. Parkinson, J.C. Dalrymple Alford al. The MoCA, well-suited screen for cognitive impairment in Parkinson disease. Neurology 2010. 75. 1717, Mike Carson al. Validity of the MoCA and MMSE in the detection of MCI and dementia in Parkinson's disease. Neurology 2010. 75. 478-479, Leoxio Guang al. Cognitive deterioration rates in patients with Parkinson's disease from northeastern China. Dement Geriat Cohn Dysad 2010. 3064-70. Hannah Plady B. al. Utility of the Neurotrax computerized battery for cognitive screening in Parkinson's disease, comparison with the MMSE and the MoCA. International Journal of Neuroscience, August 2010. 120, 8, 538-43, Sarah H. al. Pilot study of a three-step diagnostic pathway for young and old patients with Parkinson's disease dementia, screen, test and then diagnose. International Journal of Geriatric Psychiatry 2010. 25, 258-265. Hoops S. al. Validity of the MoCA and MMSE in the detection of MCI and dementia in Parkinson disease. Neurology, November 24, 2009 A. 73, 21, 1738–1745, Meltzer T.R. al. Cognition and the Limbic System in Early Parkinson's Disease, a DTI Investigation. Abstract Neuroimage 2009, 47, S115. Sarah al. Montreal Cognitive Assessment Performance in Patients with Parkinson's Disease with Normal Global Cognition according to Mini-Mental State Examination Score. J. M. Geriat Soc Vol 57, Num 2, February 2009, ppA 304 Euro 308, 5. Lessig S. al. Examination of the Montreal Cognitive Assessment and MMSE in Parkinson's Disease. Abstract T82. Presented at American Neurological Association meeting, Salt Lake City, Utah, September 24, 2008. Gildy J. al. The Montreal Cognitive Assessment as a Screening Tool for Cognitive Impairment in Parkinson's Disease. MOV Disorders, Volume 23, Number 7, 2008 ppA 1043 Euro 1046, Zadikoff C. al. A comparison of the Mini-Mental State Exam to the Montreal Cognitive Assessment in Identifying Cognitive Deficits in Parkinson's Disease. MOV Dysad. January 30, 2008. 23, 2, 297-9. Huntington, Vidanovic A. al. The Montreal Cognitive Assessment as a Screening Tool for Cognitive Dysfunction in Huntington Euro Unregistered Trademark S disease. Movement Disorders, 2010, 25, 3, 401-4. Mitchell Laura al. A comparison of two brief screening measures of cognitive impairment in Huntington Euro Unregistered Trademark S disease. Movement Disorders 2010, August 18. EPUB ahead of print. Rem, Gagnon J.F. al. The Montreal Cognitive Assessment, a screening tool for mild cognitive impairment in REM sleep behavior disorder. Movement Disorders 2010, May 15. 25, 7, 936-40. Vascular, Cameron J. al. Does cognitive impairment predict poor self-care in patients with heart failure? European Journal of Heart Failure 12, 508-515. Sarah T. Pendlebury al. Underestimation of cognitive impairment by Mini-Mental State Examination versus the Montreal Cognitive Assessment in patients with transient ischemic attack and stroke. A population-based study. Stroke Journal of the American Heart Association, 41, 6, 1290-1293, June 2010. Adrian Wong al. The validity, reliability and clinical utility of the Hong Kong-Montreal Cognitive Assessment in patients with cerebral small vessel disease, Dementia Cognitive Disorders, August 2009. 2881-87. Martinic Pupovic 1 al. Mild cognitive impairment in symptomatic and asymptomatic cerebrovascular disease. Journal of the Neurological Sciences, Volume 257, Issues 1-2, June 15, 2007, pages 185-193. Martinic Pupovic I. al. Early detection of mild cognitive impairment in patients with cerebrovascular disease. Acta Clin Croat 2006. 4577-85. Tumors, Olsen R. al. Feasibility study of the Montreal Cognitive Assessment in patients with brain metastases. 0941-4355-1433-7339 Supportive care in cancer. Wednesday, March 12, 2008, 16-1273-1278. Olsen R. al. Prospective comparison of the prognostic utility of the Mini-Mental State Examination and the Montreal Cognitive Assessment in patients with brain metastases. 0941-4355-1433-7339 Supportive care in cancer. Tuesday, October 19, 2010, published online ahead of print. doi 10.1007 per second 00520-010-1028-1, Olsen R. A. al. Prospective comparison of two cognitive screening tests, diagnostic accuracy and correlation with community integration and quality of life. Journal of Neuro-Oncology, accepted April 17, 2011, and published online ahead of print. doi 10.1007 per second 11060-011-0595-4, Schizophrenia, Predia, Adamia, Kemp A.S., and Nguyen, D. MoCA, a screening instrument for the assessment of cognition in schizophrenia. In abstracts from the 13th International Congress on Schizophrenia Research, Schizophrenia Bulletin, 37, S1, 225-226. Reviews, Ziad Nasreddine et al. Brief Cognitive Screening Instruments, an Update. Int J. Geriat Psychiatry 2010. 25, 111-120. Brer J. Apples, MSc and Eric Scherder, Ph.D. The diagnostic accuracy of dementia screening instruments with an administration time of 10 to 45 minutes for use in secondary care, a systematic review. American Journal of Alzheimer, a Unregistered Trademark S Disease and Other Dementias 2010, 25, 4, 301-316. Loney Jane A. al. Screening for Mild Cognitive Impairment, a Systematic Review. International Journal of Geriatric Psychiatry 2009. 24, 902-915. Cherokee al. Can you have dementia with an MMSE score of 30? AMJ of Alzheimer, a Unregistered Trademark Estis and Other Damon, Oct. November 2007. 22-5. 406-415. Howie. Initial screening of patients for Alzheimer, a Unregistered Trademark S Disease and Minimal Cognitive Impairment. Psychiatry, Volume 4, July 2007. 24-27. Gautier et al. Mild Cognitive Impairment. Lancet. April 15, 2006. 367, 9518, 1262-70, Review. Hodchinski et al. National Institute of Neurological Disorders and Stroke, Canadian Stroke Network, Vascular Cognitive Impairment Harmonization Standards. Stroke. 2006, Set. 37, 9, 2220-41. Allen L. al. Mild Cognitive Impairment, an Opportunity to Identify Patients at High Risk for Progression to Alzheimer, a Unregistered Trademark S Disease. Clin 2006. 28 991-1001. MoCA for the Blind, Walter Whittish, Natalie Phillips, Ziad Nasreddine, Howard Schichko. Sensitivity and Specificity of the Montreal Cognitive Assessment modified for individuals who are visually impaired. Journal of Visual Impairment and Blindness, 104, 6, 360-368, June 2010.